Hey, future RN. Heart sounds are one of the most important assessment skills tested on the NCLEX, from the normal S1 and S2 to the abnormal S3, S4, murmurs, and extra sounds. Today, we're going to cover everything you need to know to identify them and understand what they mean. Welcome to ClearPath NCLEX, your go-to channel for high-yield content that helps you pass on the first try. So, here's our game plan for today. We're going to start with the basics, the normal S1 and S2 sounds. Then we'll dive into the extra sounds you absolutely have to know, like S3 and S4. We'll also unpack what heart murmurs are, touch on splits, and then I'll give you some super practical tips for auscultation. And of course, we'll finish up with a practice drill to make sure all this information really sticks. All right, let's start with the foundation. You really truly have to know the normal sounds, S1 and S2, like the back of your hand. Everything else we talk about today is built on this, so let's get this locked in first. So what exactly are heart sounds? It's actually pretty simple. They are literally just the sound of your heart valves closing. That's it. The noise is created as blood moves through the chambers and those little valve doors snap shut. The NCLEX loves to ask which valves are closing and when, so let's break that down right now. Okay, let's get into the classic lub-dub. That first sound, the lub, is S1. This happens when the atrioventricular, or AV valves, that's your tricuspid and mitral valves, slam shut. This marks the beginning of systole, which is when the ventricles are contracting or squeezing blood out. Now, where do you hear it best? S1 is loudest at the apex, which is the bottom tip of the heart. Then you have the dub, which is your S2 sound. This is the sound of the semilunar valves, the aortic and pulmonic, closing. This marks the beginning of diastole, when the ventricles relax and fill up with blood again. S2 is loudest at the base of the heart, which is actually at the top. Now let's talk about the extra sounds. These are the ones that tell you something might be wrong. If you hear an S3 or an S4, it's a sign of trouble, and you can bet the NCLEX will expect you to know exactly what that trouble is. So let's listen closely. Okay, first up is the S3 sound, often called a ventricular gallop. It's a low-pitched sound that you hear right after S2. So the rhythm sounds kind of like lub, dub, ta. What causes it? It's a sudden rush of blood splashing into a ventricle that's already volume overloaded. So here's the absolute key takeaway. When you hear an S3, your brain should immediately think fluid volume overload. This is the classic textbook sound of heart failure. Next, we have the S4 sound, or the atrial gallop. Now pay attention to the timing here. This one happens right before S1, so the rhythm sounds more like ta-lub-dub. So what's going on? The atria are forcefully contracting to push blood into a ventricle that is stiff and non-compliant. It doesn't want to stretch. The number one cause for this is long-term hypertension, which leads to ventricular hypertrophy, or a thickened heart muscle. So S4 means a stiff ventricle. All right, let's move on to heart murmurs. I know this topic can feel a little intimidating, but I promise the concept is pretty straightforward. A murmur is simply the sound of turbulent or choppy blood flow. Let's make it make sense. So a murmur is just a blowing or swishing noise that you hear in between the normal lub-dub. Think about it like this. Water flowing through a nice, smooth hose is pretty quiet, right? But if you kink that hose or put a thumb over the end, the flow gets turbulent and you hear a whooshing sound. That's a murmur. It's usually caused by one of two things, either stenosis, where a valve is too narrow and stiff, or regurgitation, where a valve is leaky and doesn't close all the way. Now, murmurs are graded on a scale of 1 to 6 to describe how loud they are. Grade 1 is super faint, really hard to hear. Grade 6, on the other hand, is so loud you can hear it even with the stethoscope completely off the chest. But here's a key term you need to know for the NCLEX: thrill. A thrill is a vibration that you can actually feel with your hand on the person's chest, and that starts at a grade 4 murmur, so if you can feel it, it's at least a grade 4. Okay, let's talk about something called a split. Now, don't confuse this with an extra sound like an S3 or an S4. A split is different. It's more of a timing issue with our normal S1 or S2 sounds. A split happens when the two valves that are supposed to close at the same time don't. For example, S2 is the sound of the aortic and pulmonic valves closing. Usually they close in perfect sync and you hear one dub, but sometimes one closes just a fraction of a second after the other. When that happens, you hear the two separate closure sounds, like a quick dub instead of just dub. You're just hearing each valve close on its own. All right, let's get super practical. This is huge for the NCLEX. You have to know exactly where to put your stethoscope to hear each valve the best. This is where we put all the theory into practice. Pay close attention here. This is high-yield stuff. The easiest way to remember the listening spots is with the mnemonic, all patients take medicine. The first letters stand for aortic, pulmonic, tricuspid, and mitral. So the aortic area is in the second intercostal space, just to the right of the sternum. The pulmonic area is also in the second intercostal space, but to the left of the sternum. The tricuspid area is down at the fourth intercostal space on the left. And finally, the mitral area is at the fifth intercostal space in the mid-clavicular line. Remember, S2 is loudest at the base, that's your aortic and pulmonic spots, and S1 is loudest at the apex, which is the mitral area. So what if you're listening and you're struggling to tell which sound is lub and which is dub? Here are a few pro tips. First, just move your stethoscope. S1 is always louder at the apex, and S2 is louder at the base. Another fantastic trick is to gently feel for the patient's carotid pulse while you listen. The sound that you hear at the same time as the pulse beat, that's your S1. And if your patient happens to be hooked up to an EKG monitor, S1 lines up perfectly with that big spike, the R waves. Okay, you've absorbed a lot of information. Now it's time to put it to the test with a few practice questions. This is the best way to make sure you can apply what you've learned on exam day. You ready? Let's do it. Okay, first question. A nurse auscultates a low-pitched sound in early diastole on a patient with fluid volume overload. What is this sound? Go ahead and pause for a second if you need to think about it. And the answer is S3, the ventricular gallop. Remember, early diastole, right after S2, plus fluid overload is the classic presentation for an S3 sound. You've got this. All right, next step. An S4 heart sound is associated with which underlying condition? Think about what causes that to love dub sound. The answer is a stiff, resistant ventricle. That S4 sound is the atria trying to squeeze blood into a tough, non-compliant ventricle. This is what we see in patients with chronic hypertension or ventricular hypertrophy. Awesome job. Last question, let's talk location. At which auscultation point is the S2 sound, the dub, typically the loudest? Try to picture that diagram in your head. The correct answer is the base of the heart. Remember, S2 is the sound of the aortic and pulmonic valves closing, and we hear those best up top, at those second intercostal spaces. Excellent work. Okay, let's do a super quick recap with your official NCLEX cheat sheet. Go ahead and screenshot this slide. S1 is lub, the AV valves closing at the start of systole. S2 is dub, the semilunar valves closing at the start of diastole. S3 is a gallop that screams fluid overload or heart failure. S4 points to a stiff ventricle from hypertension. Murmurs mean turbulent flow. And for where to listen, just remember, all patients take medicine. Seriously, if you can master these sounds, you are going to crush these questions on the NCLEX. You've got this. Thanks so much for watching ClearPath NCLEX. If this explainer helped you, please give it a like and subscribe for the most high-yielding content. Hit that notification bell so you never miss the next game-changing NCLEX tip. And drop a comment below. Which heart sound do you find easiest to remember? I read every single one. You're doing amazing. Keep studying. You've got this. See you next time.